Gentlemen, in my 15 years as a urologist, I've encountered one concern more frequently than almost any other medical issue when treating men over 60. It's not prostate problems. It's not erectile dysfunction. It's men asking me, quietly and often with embarrassment, whether there's something they can do about their size. This conversation happens in my office at least 3 times per week. Successful businessmen, retired professionals, grandfathers, all wondering if they measure up to some standard they've created in their minds. What's fascinating is the disconnect I've observed. While over half of men express dissatisfaction with their dimensions, research involving their partners tells a completely different story. When women were surveyed about their partners, 85% reported complete satisfaction. That gap between self-perception and reality is where today's conversation begins. Because what I've learned from treating thousands of men is that this isn't really about anatomy. It's about confidence, anxiety, and misinformation. I'm Dr. Amara, and today I'm going to share what medical science actually tells us about male enhancement, separating legitimate treatments from dangerous nonsense. If you appreciate honest medical information without the marketing hype, hit that subscribe button. Drop a comment with your location. I love seeing our global community. And like this video if evidence-based health content matters to you. Before we discuss treatments, let's address what I call the measurement obsession affecting men over 60. In my practice, I've noticed something interesting. Men who come to me concerned about size are rarely dealing with a medical abnormality. The average erect length is about 5.2 inches, and anything within a broad range around that number is medically normal. True micropenis, a genuine medical condition, affects fewer than 2 men in every 1,000. So, statistically speaking, if you're watching this video, your anatomy is almost certainly within normal parameters. What's really happening is what we term size anxiety disorder. This psychological condition can be more damaging to your intimate life than any physical characteristic ever could be. I've seen patients whose relationships suffered not because of their anatomy, but because of their fixation on it. The anxiety becomes the real problem, not the perceived physical issue. Let me walk you through what actually works versus what's marketed to exploit your insecurities. First, let's eliminate the obvious frauds. Pills and creams marketed for enlargement have zero scientific backing. I cannot stress this enough. There is no oral medication or topical application that can permanently increase penile dimensions. These products typically contain mild vasodilators that might improve blood flow temporarily, creating the illusion of enhancement. But tissue structure cannot be altered by consuming herbs or applying lotions. Then we have the truly concerning options: underground injections and unregulated surgeries. I've treated men who suffered permanent damage from silicone injections or overseas procedures. These complications can include chronic pain, erectile dysfunction, tissue death, and permanent disfigurement. The risk-to-benefit ratio is catastrophically poor. Vacuum pumps deserve mention here. While legitimate medical devices exist for treating erectile dysfunction, pumps marketed for permanent enlargement are misleading. They create temporary swelling, not permanent growth. This brings us to the only non-surgical approach with consistent research support: mechanical traction devices. These devices apply gentle, sustained tension over months of daily use. Clinical studies show average gains of about 0.8 inches in stretched length after 6 months of consistent use. However, this requires wearing the device several hours daily for months. Many men find this commitment impractical, and roughly 30% of users see no measurable results. Here's my standard advice for patients with size concerns. Address the psychological component first. If your partner expresses satisfaction, consider whether you're solving a real problem or feeding an anxiety disorder. Optimize what you can control immediately. Cardiovascular health dramatically impacts sexual function. Weight loss can make you appear larger by reducing pubic fat. Hormone optimization can improve confidence and performance. If you pursue traction therapy, do so with realistic expectations and medical supervision. This is a long-term commitment, not a quick solution. Most importantly, focus on overall sexual health rather than isolated measurements. Blood flow optimization, stress management, and communication skills impact intimate satisfaction far more than dimensions. In my experience, men who work on confidence, health, and emotional connection report significantly better intimate experiences than those obsessing over measurements. Your partner cares about your energy, attention, and emotional presence far more than any physical measurement. The pornography industry has created unrealistic standards that have nothing to do with real intimate relationships. I've seen 70-year-old patients with complete confidence who have incredibly fulfilling relationships, and 40-year-old patients with above-average anatomy who struggle because of anxiety. The difference isn't physical, it's psychological. Your worth isn't determined by measurements. Your intimate satisfaction depends far more on health, confidence, and emotional connection than on anatomy. If size anxiety is affecting your life, address it directly, either through counseling or by focusing on controllable factors like cardiovascular health and stress management. Remember, your best years of intimacy and vitality can absolutely be ahead of you, regardless of your age or measurements. If this medical perspective helped clarify things, please like and subscribe for more evidence-based men's health content. Comment below. I read every single response. I'm Dr. Amara Cruz, reminding you that confidence is the most attractive quality you can develop. Take care of your overall health, and everything else tends to follow.